Okay, very good evening to you. It's just after 5 o'clock. Welcome along to our first of two virtual events relating to the Essex and Suffolk Elective Orthopaedic Centre. This is first of two engagement events virtually that we're running. My name is Simon Morgan. I'm Associate Director of Communications for the Suffolk and North East Essex Integrated Care Board, the ICB, as it's known. That's the organisation that is responsible for commissioning and buying local NHS services across Suffolk and North East Essex. Let me introduce you to our panel this evening, starting off with Andrew Dunn. Andrew.
Yeah, thanks, Simon. So I'm Andrew Dunn. I'm a consultant orthopaedic surgeon at West Suffolk Hospital, where I worked for the last 21 years. I'm the clinical director of the Essex and Suffolk Elective Orthopaedic Centre, and I'm also joined by my colleague, Mr. Conrad Ronker, who's a consultant specialist hip surgeon at West Suffolk Hospital. He's also the joint clinical lead at West Suffolk in orthopaedic surgery. So yeah, first slide, please.
Oh, just before we move on to the slides, let me just explain a little bit about the format of this evening. So, Conrad, thank you very much indeed for joining. So, over the next half an hour or so, we're going to go through the slide deck with you, and we're going to present the proposal, the case for change, and then we're going to invite questions at the end of the slides as well. So, please feel free to post any questions you may have. You're welcome to put them into the chat, and we will read them out, and then either Andrew or Conrad will respond to those questions. So we're hopeful that we'll have plenty of questions this evening, and of course there's lots more information on our website. We'll come on to that in a short time. So Andrew, if I can hand over to you then to make a start on the presentation, please. Thank you.
Okay, thanks, Simon. So the proposal to move some elective orthopaedic surgery from the West Suffolk site to the Elective Orthopaedic Centre in Colchester is because nationally there's been unprecedented levels of disruption on elective hospital care across the country due to the coronavirus pandemic. And nationally waiting lists have surged from 4.57 million by 61% to 7.74 million. At the start of this year, and this was largely because during the coronavirus pandemic, routine, hospital treatment was stopped, and reducing the backlog is one of the government's national priorities. Ministers set up an elective recovery task force to tackle the growing waiting list problems and ensure all capacity was put to best use. And at national level, one of the considerations was to establish elective surgical hubs across the country. The government have funded 100 surgical hubs already, and then by March next year there'll be 130 up and running across the country, and this has involved them spending £1.6 billion, so a huge amount of investment. Next slide, please. So what we're going to show you shortly is a video that's been put together by GIRFT, who are a national improvement programme, and that's short for Get It Right First Time, and that explains what an elective surgical hub is. And an elective surgical hub is separated from the main hospital building because currently delivering healthcare where hospitals are trying to do everything on one site is really, really difficult and challenging because of the pressure of emergency work, because of the pressures of trauma, and that results currently in a lot of patients' surgery being cancelled or postponed. So next slide, please. So we're going to just show the short video now. It's only 2 to 3 minutes.
This video explains what surgical hubs are and how they can benefit you. The Patients Association developed this video in partnership with patients and carers and in collaboration with NHS England's Getting It Right First Time programme. What are surgical hubs? Surgical hubs are hospital sites that offer access to common operations and procedures, such as cataract surgery, hip and knee replacements, and other planned procedures. They are typically located in a separated area within a bigger hospital or in a separate building. There may be a hub situated in your local area, or you may have to travel to another area. Surgical hubs are commonly managed by NHS hospital trusts and meet the same high standards of clinical care and safety as all NHS hospitals. Surgical hubs have been operating successfully for years, but in order to provide more capacity for planned surgery and help reduce waiting times, even more have been set up across the country. What are the benefits of having surgery at a surgical hub? Surgical hubs help reduce waiting times for surgery. This may prevent your condition from getting worse and reduce the time you spend managing your health condition at home. Surgical hubs also reduce the risk of short-notice cancellations because they don't take accident and emergency patients. They also bring together experts from all stages of patient care, helping you to go home soon after surgery. How do I know if I can have my operation at a surgical hub? If it's clinically appropriate for you to have your operation at a surgical hub, and it enables you to receive timely treatment, you will either be referred directly or contacted to offer you the option of going to a surgical hub. Once you have been referred, you can contact the surgical hub directly to get more information, ask questions, and learn about what to expect with your surgery. Here are some quotes from patients who've had their surgery performed at a surgical hub. Tackling waiting times is a top priority for the NHS, and surgical hubs are key to achieving that goal and ensuring patients get timely access to the surgery they need.
So what's happening locally with regards to our waiting list? So we can see that in Suffolk and North East Essex, our waiting lists are increasing. Next slide, please. And we can see that as a result, as well as our waiting list increasing, we're performing fewer operations within Suffolk and North East Essex. This is data from West Suffolk Hospital showing that the number of hip and knee replacements we've been able to perform since the pandemic has not approached pre-pandemic levels because of the challenges that we've already mentioned. Next slide, please. And one of the reasons is because our trauma and emergency workload is increasing, and we can see that the number of hip fractures we're treating has increased by 20 to 30% since 2015. Next slide, please. And that means that we're relying increasingly on the private sector, on private hospitals to perform more surgery. And this isn't just a problem locally; it's a problem, nationally as well. Next slide, please. So in April of 2022, a business case was approved which enabled the ICB to construct an elective orthopaedic centre containing 6 theatres and 2 wards. 3 months later, a case was approved to expand the centre to have 8 operating theatres and 3 wards. So the ambition is to deliver around 10,000 operations, per year at the centre. There's obvious collaboration and relationships between West Suffolk and ESNET. ESNET is the merged hospitals of Ipswich and Colchester, because we operate and work within the same healthcare system. And based on the capacity available to West Suffolk, it's proposed that around 60% of orthopaedic elective operations, around 1,300 to 1,500 per year, a move from West Suffolk in Bury St Edmunds to the Essex and Suffolk Elective Orthopaedic Centre and the Dame Clare Mark Centre at Colchester Hospital, but numbers may fluctuate dependent on case mix. And this will leave 1,300 procedures per year at the West Suffolk site, including all children's orthopaedic surgery and all patients pre-op assessment, their initial outpatient consultation and their post-op follow-up visits would still occur at West Suffolk Hospital and the clinics that we all work in Newmarket, Sudbury, Thetford and Stowmarket, etc. Next slide, please. So if you want some more information about the numbers of procedures that we're proposing to move to the centre, you can see more detail there. And it's predominantly hip and knee replacement, surgery, less upper limb, foot and ankle and shoulder and day case procedures will be moved. Next slide, please. So what's the case for change? So under the proposal, as we've already mentioned, this would leave approximately 1,300 procedures to be performed on the West Suffolk site, including all children's orthopaedic surgery. As we've already mentioned, it's proposed that all preoperative outpatient appointments and post-operative outpatient appointments would continue at the West Suffolk site in its existing peripheral clinics. But there is clearly a need for increasing our surgical capacity for orthopaedic surgery as there's a clear predicted growth of the population, and also our population within the west of Suffolk is becoming increasingly elderly. And more elective surgical capacity is required to reduce excessive waiting times for our patients. So next slide, please. And what's the benefit? So you've already heard about some of the benefits in the video. By moving work to SCOP from West Suffolk, we're predicting that patients will see waiting times for surgery reduce. The primary focus is on delivering planned elective care, and this will enable our teams to focus on delivering excellent care and reducing the amount of time that patients spend in hospital following their procedure. Revision expertise, so the centre is one of the two centres in the east of England for complex revision knee surgery, and by having 50 to 60 orthopaedic surgeons from West Suffolk, Ipswich and Colchester working together, will be one of the largest orthopaedic centres in Europe and indeed the country. By increasing the capacity at the orthopaedic centre, this will allow theatres that are currently being used for orthopaedic surgery to be used by other specialties, because it's not just orthopaedic surgery that's got waiting list challenges. Our colleagues in gynecology, ENT and general surgery also have long waiting lists too. And the centre will be a training centre for orthopaedic trainees already working within the region, because as the College of Surgeons routinely say, if there's no training today, then there'll be no surgery tomorrow. And as we've already mentioned, this will free up an operating theatre at West Suffolk, which will allow more work to be done by the specialties on the West Suffolk site. So next slide, please. And this is data from a study undertaken by the Health Foundation, and it shows that when you look at high volume, low complexity procedures, so in orthopaedic surgery, that's particularly hip and knee replacement procedures, that hospitals that have access to a surgical hub will generally deliver 21% more activity than hospitals that don't have access to surgical hubs. So surgical hubs are making a real difference to patients and reducing waiting times. I'm now going to hand over to Simon, who's going to talk about the engagement exercise.
Lovely, thank you very much indeed, Andrew. We'll have the next slide, please, Sarah. There we go. So our approach to the engagement and communications in relation to the Essex and Suffolk Elective Orthopaedic Centre engagement activity. So we really do want to hear from as many people as we possibly can about this proposal and to understand really the impact it would have on local people. And we want to work with local people to overcome any issues that they do identify. So we're working very closely with Health Watch Suffolk, who are an independent organisation, and they've been really, really helpful. They've conducted or are conducting an independent survey, which they developed with local people, local patients, and also local patient participation groups as well. So the 6-week engagement exercise started just over 2 weeks ago on the 20th of May. It finishes on Sunday, the 30th of June. And during that time, we're running a number of mini exhibitions across West Suffolk. I'll come on to those in just a minute. We thought that that would be a better way to share information with local people, local communities, because what we want to do is to have information presented in an easy to understand format, information that people can digest and take away with them in their own time, and also to speak to clinicians, perhaps on a one-to-one basis. Many people are not comfortable sort of putting questions to speakers in front of an audience. So we wanted to make it more accessible to people. So we're holding about 8 mini exhibitions across West Suffolk. I'll come on to the locations in just a minute. We've developed a toolkit as well, communications toolkit for patient groups, stakeholders, PPGs within GP practices, so that they can help us to raise awareness about our engagement exercises. And we've had some really good support from our many partners, many different voluntary groups within the communities across West Suffolk. They've invited us along to their locality meetings, and we've had some really good attendances at those locality meetings where we've been able to tell people about what it is that we're proposing and how they can have their say and get involved. We've also been out and about in supermarkets, libraries, areas of high footfall across West Suffolk, and we will continue to do so over the next month or so, promoting the engagement, sharing paper copies of the survey, increasing awareness about the case for change that we're outlining here this evening to you. And our colleagues at West Suffolk NHS Foundation Trust have developed a really detailed equality impact analysis and also a travel assessment as well, and that's available on the website, on the engagement website, which I'll share with you in just a second. Another thing that we've been doing over the last couple of weeks, we've been working quite closely with our partners in the media. So we've had a really positive response in the local and regional media. There was a nice piece about the engagement on ITV Anglia last week, which my colleague Ruth facilitated in the team. But also we've been working with our partners at the Very Free Press to advertise the case for change, to advertise our mini exhibitions as well. So that's something else we've been doing, and the adverts will be repeated in this coming weekend's Very Free Press titles. And those titles include the Town Centre edition, of course, but also the Suffolk Free Press, which covers Sudbury, the Haverhill editions, Mildenhall, Thetford, Newmarket, etc., Mid-Suffolk editions as well. So hopefully the message has been received far and wide. We've got our 2 virtual events, this being one of them. The next one after today is on Saturday, the 15th of June at 10 o'clock. And on top of that, we have got leaflets about the case for change. Here's one that you may well have seen out and about. We've got lots of those available to give out at mini exhibitions. And my colleagues within the West Suffolk Trust, Cassia, Anna, and other colleagues have been handing those out at the outreach pop-up stands that we've been having across West Suffolk. And also online are copies of easy read translated materials, and also materials available in audio format. So the leaflet that I just showed you there is available in audio format and easy read as well, if anybody would like to have access to that. And if indeed printed copies of the easy read version is desirable, then please let us know. We'll make sure that's available as well. So that's our approach. If I can go on to the next slide, please. So I mentioned the mini exhibitions. This is a new approach for us in terms of engaging with local communities and local people. So on the screen there, you can see where we're going to be at over the next couple of weeks or so as part of our engagement effort. So you can see there, this coming Saturday between 10 and 12, we're at the Apex in Bury. These are basically drop-in sessions. They're not going to be 2-hour events. They will be there for 2 hours, but an opportunity for local people to come along, speak to colleagues like Andrew and Conrad, who we'll bring in just a second. On Tuesday the 11th, then, we're at the Newmarket Racing Centre between 10 and 12 noon. Tuesday the 11th of June at the Innovation Centre in Thetford. That's between 2:30 and 4:30. The Haverhill Arts Centre on Wednesday the 12th in the evening between 6 and 8. Thursday the 13th of June in Sudbury at the Kingfisher Leisure Centre between 2 and 4. On Friday the 14th of June then at the New Bury Community Centre in Bury St Edmunds between 5 and 7 in the evening. The 18th of June between 10 and 12 at St John's Centre in Mildenhall, and then concluding in Brandon at the Leisure Centre there between 2 and 4 p.m. on the 25th of June there. So hopefully we've got a number of different mini exhibitions that local people, communities will be able to get along to and find out more, read about the case for change that we're presenting. And as I say, those mini exhibitions have been featured in the local media and widely promoted within the Bury Free Press, on social media, on the television, and also on our websites as well. Next slide, please. So the next stages, once the engagement has closed on the 30th of June, will be an update to our councillor colleagues at the Health and Overview Scrutiny Committee. And we're very fortunate in this part of the world. We have an excellent councillor community who are very supportive with any engagement and consultation activities that we get involved with. So we're very grateful to them for their continuous support and help with this as well. So at the HOSC meeting on the 17th of July, members there will be getting an update about how this engagement exercise has been, any key areas of feedback as well. So that will be on the 17th of July. On the 30th of July then, our ICB board will be meeting to look at the feedback, and it's important to say that the feedback will be via an independent analysis report that Healthwatch Suffolk will be producing on our behalf. And it's really important that we have an independent provider who will be producing that report. The last thing we wanted is a report, an engagement carried out by the NHS with a report produced by the NHS. So having that independent voice, an independent report will hopefully make the process even more transparent for our local communities and colleagues. And then the ESIOG, as it's known, which is short for the Essex and Suffolk Elective Orthopaedic Centre, of which will be based in Colchester, is due to open later on this year in the autumn. Next slide, please, Sarah. And then just finally to say, I mentioned the website with a lot more information on, so you can see there a link to the engagement website. So Suffolk and North East Essex.icb.nhs.uk/elective is where you can find all of the information, all of the background details, links to documents, links to the Healthwatch survey, and it's there, it's live now. So please do have a look at that whenever you get a chance to. So Conrad, I'm going to invite you now in. Is there anything else you'd like to say at all, or anything you'd like to add to what's already been said?
Well, I think Andrew's and your presentations just show what it is about. I think it's the centre will allow us to reduce waiting times for surgery, and patients been waiting way too long and suffering in pain way too long, and we're looking forward to starting using it, really.
Lovely, thank you ever so much indeed, Conrad. So with the time now at 5:25, I propose that we open this up for any questions. If you do have any questions, please put them into the chat. We will be able to pick them up this end and read them out, and I will invite Conrad and Andrew, or Andrew, to answer the questions that come through. So please do feel free to post your questions or comments in the chat. If we don't get any, not a problem. We will just finish this this meeting earlier. But let's just go back to some of the points that were made in the presentation. And Andrew, this is going to be Europe's largest elective orthopaedic centre. That's right, isn't it?
I mean, one of the largest. There are
one of the largest,
like the Royal National Orthopaedic Hospital at Stanmore and the Robert Jones and Agnes Hunt hospital, which is a specialist orthopaedic hospital in Oswestry in Shropshire, that you know have 10, 12 theatres. But I think, as Conrad's already mentioned, it's a fantastic facility for our you know region to have, an RICB to have. And it's attracted a huge amount of interest, and I think you know we'd like it to you know become what you know Royal Papworth is to you know cardiac and respiratory you know surgery and medicine. We'd like Essex to become you know a regional centre for orthopaedic surgery and a national centre for orthopaedic surgery.
Indeed. Conrad, a quick question to you, if I may, around the waiting times, and Andrew mentioned, and you touched on it there as well, that waiting times will be reduced as a result of this new centre going online. Just tell us a bit about those waiting times, and by how much do you think that they could be reduced when this centre eventually opens?
I mean, people currently wait in excess of a year for joint replacement surgery, for orthopaedic surgery. I think if we use a centre in Colchester as an additional resource, which will be well run, very efficient, without cancellations, with all support for patients they need, we can perform a huge number of surgeries there. And if we use it as addition to doing still surgery in West Suffolk for patients who prefer to have surgery in West Suffolk for various reasons, I think this will lead to a significant reduction of waiting lists. And it's really hard to put a number on number of weeks or months, but I think this gives us real chance to reducing these waits, you know, to weeks which you can count rather than months you count eventually.
Thanks, Conrad. Andrew, I'm going to come to you in just a second to see whether you might have a response about transport. Just before I do, Conrad, back to you if I may, because one of the things that this new centre will be focusing on is about training the surgeons of tomorrow. Is there anything you might want to say about that at all? Or indeed, Andrew, please do come in.
I'll let Conrad answer, because Conrad's very involved he organises a lot of training and teaching at West Suffolk and is a real advocate for the junior doctors. So I'll let Conrad answer that, because I think he and some of the trainees that work with him have experienced some frustrations over the last 2 to 3 years. So
it should allow a lot better training opportunities for our junior doctors, for registrars, for surgeons in training. Firstly, because we expect less cancellations because of the bed pressure, so we'll be able to perform large number of cases where we can participate. And with anticipated efficiency of theatre team, we should have a little bit of extra time during every day's operation day to allow for training, to let younger doctors learn the skill and craftsmanship.
Thanks, Conrad. Andrew, I can come to you first of all. We've had the first question, which has been posted into the chat. And please do feel free to put your name to these questions as well. But this one's anonymous. So the question is, my question would be regarding transport, getting to Colchester for both patients and visiting relatives. For example, Mildenhall to Colchester via public transport is virtually impossible. Is there anything at all you may wish to say about that at all, Andrew?
So I think there are, two national schemes that are already being used to support patients travelling for healthcare across the country. We know that Royal Papworth, that we've already mentioned, treat patients from all over the east of England, and in fact some patients come from all over the country, and these patients have quite, complex health needs, often come from areas of deprivation. And so we'll be doing all we can to support, patients, because we don't want to make existing health inequalities, worse. And we want patients from all over the ICB to be able to have prompt and timely elective orthopaedic surgery at the centre.
And is it the case that if transport or travel cost really is an issue, could patients choose to be seen at the West Suffolk Hospital as was? Is that an option for people?
Yes, I mean, as Conrad's described, we're still planning to perform some elective orthopaedic surgery at West Suffolk, but what we don't want is for patients to be waiting longer at West Suffolk Hospital for surgery than, say, patients who are able to go to the centre in Colchester. We already know from a lot of patients all over the east of England that some patients are travelling as NHS patients from the North Norfolk coast, so from Sheringham and Cromer and North Walsham, to some of the private hospitals in Cambridge and in Bury St Edmunds to have surgery as NHS patients. And the learning from other hub sites across the country is that patients and their support networks, families, loved ones will try do what they can to get patients to elective hubs so they can have their surgery and so it's not cancelled. The teams are working really hard. So at West Suffolk Hospital now, 30-40% of our patients having hip and knee replacement surgery are only staying in a day. They're often going home the following day. So actually, when families and relatives are often travelling back to visit patients, they're not necessarily visiting, they're picking them up to take them home.
Thanks, Andrew. Conrad, is there anything you wanted to add at all? Are you happy to?
This consultation process is to gather information about patients' needs and about how can we support in any way they travel, because it is obvious that from Brandon, from Newmarket, from Ely, which we treat patient, to Colchester, a significant distance, and there won't be a way by public transport to get there. So part of this consultation process is to find out and work is very, which way can we support patients. But really important from my perspective is that we do keep orthopaedic activity in West Suffolk. So some patient may choose for a variety of reasons to have treatment here, and we do not want to force all population of Suffolk to have to travel one way or the other to Colchester.
Thanks, Conrad. So we fully recognise that transport is a hot topic and is something that needs to be further looked at and will be and indeed is at the moment. I think that was Linda Bassett who asked that question. So Linda, thank you for your question just there. Please do, if you have any other questions, do post them in the chat. We've got one more. After that, if there are no more questions, we will draw this to a close. So the last question we have for the time being is, there has been numerous rumours that ESNEFT are unable to staff the new elective hub. Are we on target staffing wise to use the unit at full capacity, is the question. And I wonder, Andrew, whether that might be something you might have a view on at all. Do you want me to repeat the question, or are you happy?
No, that's absolutely fine. So I think that the recruitment across the whole NHS is a real challenge. There's a huge amount of interest in the centre. We organised an open day at the end of January, and we had over 400 people attend, and they were healthcare professionals from a whole variety of disciplines. What we know nationally is that elective hubs are really popular places to work, as Conrad has already mentioned. Generally, theatre lists that are carried on elective hubs, run very efficiently. There's very few, cancellations, and I think that the momentum around the centre is building. Recruitment is ongoing, and there's a lot of interest in posts, but we also accept that there are elective hubs opening in Norwich, in Great Yarmouth, there's one opened in Cambridge, and if I'm being completely honest, I suppose we're all recruiting from the same pool of people. But we're just working really hard to try and recruit the staff that we need to open the centre, to get it running efficiently and reduce waiting times for patients in our local community.
Thanks, Andrew. Conrad, is there anything that you would like to add at all?
I'm afraid on this topic, Andrew's got a lot more inside knowledge than me. My practice is solely in West Suffolk.
That's fine. Thank you ever so much, Conrad. Well, look, we've got no further questions there, so I propose we draw this to a close. Thank you very much indeed for joining us this evening. Andrew, Conrad, Sarah and Jared, thank you all very much indeed for being there too. Our next engagement event in person is this coming Saturday at the Apex in Bury St Edmunds between 10 and 12. Our next online event is on Saturday the 15th of June at 10 o'clock through our website here. And don't forget, for more information and to complete the survey, do visit our website address, which is www.Suffolk and North East Essex.icb.nhs.uk/elective. But in the meantime, with the time at 5:40, have a very good evening. Thanks very much.
Thank you, Simon. Thank you.